I'm Reeves Kurtner, and this is In Your Business. Season 1 of In Your Business is presented by Moses Auto Mall of Huntington, online at mosesmeansmore.com, and powered by the Huntington Regional Chamber of Commerce and Kindred Communications. This week, we sit down with CEO Stacey Sheils and Chief Marketing and Communications Officer Doug Sheils from OVP Health. They've recently steered their company through a major rebranding effort, and today, we're peeling back the layers of that journey. We'll discuss the reasons fueling the rebrand, the strategic decisions, style books, the hows, timelines, and even meetings on fonts. Let's get in your business. Introduce yourself so we can put a voice to the name.
My name's Stacey Sheils. I'm the CEO of OVP Healthcare, or OVP Health, I should say. I've been here since 2006.
And my name is Doug Sheils. I'm the Chief Marketing and Communications Officer for OVP Health. I started with the company in 2020, right at the beginning of the year, but I was a contractor for the company providing contract content marketing services about 2.5 years prior to that.
And so today we want to talk about branding and rebranding. Stacey, start by giving us like a brief overview of OVP Health and its history.
Well, OVP Health started in 1999. My father and his partner, Dr. Bob Hess, were primary care physicians here in Huntington. Wanted to do something different, so they formed OVP Health back in 1999. I joined in 2006, and once I joined, we kind of got into the outpatient office environment, started doing some addiction medicine, which really allowed us to expand the outpatient offices. And through that process, I had opened up offices in Eastern Kentucky, Southern West Virginia, up in Ravenswood. And I had, interesting enough, I had given each of those different names.
Okay.
Eastern Kentucky Primary Care Specialist, Southern West Virginia Primary Care Specialist, West Virginia Primary Care Specialist, trying to give them a connection to each of those little communities. And because when we initially went down into Eastern Kentucky, for example, I got a lot of negative feedback because Ohio Valley Physicians, which was our name at the time,
right,
didn't play well in Eastern Kentucky.
I'm not from Ohio. I'm from Kentucky. Don't
correct.
Call it Ohio Valley.
So I renamed it Eastern Kentucky Primary Care Physicians and did business that way. Well, when we started, Doug moved downstairs there in the mezzanine of our corporate office, and we started using Doug, and he came to me one day. He goes, "Listen, I think it's a great opportunity to do a rebrand of Ohio Valley Physicians." And then he went on to tell me all the things I did wrong as I opened up all these offices. And he done it in a very skilled way, so I'll give him credit. Because you're losing all of the brand equity in your business by having, because you basically have 8 or 9 different companies and no one knows the others exist, and you're just losing all this brand equity. And so there was a lot of discussion about it, wasn't there, Doug?
There was a lot of discussion.
We were very loyal to Ohio Valley Physicians. It had been very good to us, and specifically my father and his partner.
Right.
But, Doug had convinced me that, and we've convinced them that this was an opportunity to retell our story.
Okay.
And we thought we had a great story. We thought that there were bigger things on the horizon for us, and so we went through the process of rebranding Ohio Valley Physicians into OVP Health. And I'll turn over to Doug to kind of let him tell you how that process went.
Yeah.
And I'll ask too. When you said I'm joking, hey, you told me everything that I did wrong. But I mean, how was that conversation? When you came on board and you had, how many different names do you think you had?
I probably had 6 or 7 at least.
Yes.
I don't have a number.
No, sure.
Doug makes it a little bit more dramatic.
Yeah, but so I mean, talk about that conversation as a.
Yes.
And this is also, again, this is a podcast that it's for businesses, and this is also kind of a good lesson too of how the marketing guy can talk to the CEO as well in those kind of conversations too. You don't want to insult the boss and be like, you're doing it wrong, but how do you have that conversation?
Exactly. Well, at first, I mean, I was not an employee of the company. I was a contractor, and so I was a little more than nervous about bringing it up, particularly because when you do a rebranding, it's going to be expensive.
Absolutely.
I mean, if particularly
if you do it right,
the more offices that you have, the more facilities, the more signage you have to change. There's a lot involved in it. So it was a delicate conversation. I think I brought it up once to him very lightly. Then another time, I think you were driving down to Eastern Kentucky, and I had a discussion with you in the car because, I mean, he was a captive audience there, and he couldn't throw me out of the car. He could, but, yeah. But I think when you approach it from a position of respect for the company and real concern, but also explain the benefits and the opportunities that you can capitalize on if you were to do this. Not to mention some of the further problems that you can develop if you don't change.
Right.
You just kind of compound the problem the more you grow.
Right.
And you dilute the brand a little bit. So, I've been giving it some thought as to what we might be able to do. And Stacey and Dr. Hess, our co-founder, asked me to kind of put a presentation together and present it to the group. And they reacted favorably to it. This was not the where I presented what the options were for rebranding, but just to we're open to the process.
Right. So how long before when you were having those early conversations to when it finally got greenlit? How long was that process?
Well, we were looking at one of our documents today where I was bringing up the issue, and that was dated December of 2017.
Okay. And
we went live with the rebrand in January of 2019.
Okay.
So it was a little over a year.
Sure.
Yeah.
So when you went, what was happening in like those 2 years there?
Between
2017 and 19.
Okay, it was more like a year because it was December to January.
Fair.
There was a lot of looking at our existing branding, doing a lot of research, looking at how other healthcare companies had rebranded, looking into some of the pitfalls that you need to really be careful of when you're rebranding. But then also working with a graphic designer that I trusted to come up with a number of options that we could go in with some of my input on what we thought was important. What we thought was most important was, Ohio Valley Physicians has a very proud history.
That's right.
And, and most important, they've got a set of 4 core values that really define who we are. And we wanted to really take advantage of that and use this rebranding as an opportunity to tell our story.
Sure. So what specific goals did you all have, with this rebrand? What were the specific goals that you were trying to achieve with this rebrand?
I'll just say, if we had 7 or 8 different identities, 7 different names, Eastern Kentucky Primary Care,
right,
is to bring it all into one.
Okay.
So instead of having the 7 that you have to make a brand, to build equity in a brand so people recognize it, you have to spend money and you have to spend time to do that. Well, if you just have one brand, you focus all your time and energy and money into that.
Right.
That was extremely important.
Yeah.
So.
I think it's just being focused to the values and being able to, again, I talk about the rebranding for us allowed us to retell our story, reintroduce ourselves to people who didn't know us and people who knew us, but maybe didn't know us as well as we thought they did.
Yeah.
And so it was a great opportunity for us to reintroduce ourselves to the community.
And we didn't really lose any brand value that we had in the previous company because a lot of people called us OVP anyway for Ohio Valley Physicians. And so we just thought, well, let's just call it OVP Health.
Right.
I mean, people might not know what OVP Health stands for, but you don't know what CVS Pharmacy stands for, or some people don't know what AT&T stands for. But it was just a way for us to kind of keep a part of that history, but move forward as well.
So you mentioned like the market research. What kind of market research were you doing, in that year during that preparation time?
There's a lot of that you can learn online.
Yeah.
Doing searches for primarily healthcare companies, also doing local market research as well. You really need to know what's going on in your market, I believe, to get the most benefit out of your rebrand. In our healthcare market, we've got two major hospitals,
Sure.
Cabell Huntington and St. Mary's. I was involved in the Cabell Huntington rebrand, but when we went from kind of a burgundy color
Right.
to green, and we went to green because of Marshall University, Marshall
Sure.
Health. The two colors of the hospitals were blue and green, and we thought, you know what, we are interested in perhaps doing business with the hospitals in this market.
That's right.
And so we need to really kind of think about, in co-branding, how can we do that? And so we determined we needed to go green and blue. And when we looked at shades of green and blue, we could have gone with the darker shades and that sort of thing. But we made a conscious effort that when we make this rebrand, we want it to be exciting and fresh and new and modern. And so we went with a more vibrant green and a more vibrant blue, and I think it's paid off for us.
Sure. Were you a part of Stacey, look at the colors and so forth? Was that, you talk about that process, just
Certainly.
look at the colors?
I've never talked so much about font in all of my life.
Right.
And I remember walking out of the meeting thinking, did I just really have a meeting for half an hour on font?
Yeah.
Yes, I did.
Right.
But it was just part of it. It was great.
is.
It was a great educational process. And I think that, again, as we look back, I can look at 4, 5, 6 things in the history of our company that has really set us apart or allowed us to continue to grow, and none of them has been more beneficial to us than this rebrand.
Right.
And how that's allowed us to, again, retell our story, to build the brand equity. I think you see it in all of our offices. I say it all the time, it's amazing how many people order shirts and logoed gear from our corporate shop because they're proud of the brand and what we've created. And so all that can be tied right back to this rebranding process and what we've accomplished with it.
So how would you say, why has this been successful so far? What can what you've done so far, this is working, we can tell because of this?
Well, I go back to just the employee buy-in of what we're trying to accomplish and the core values. And again, I think Doug's skill in presenting this, not only to our leadership, to our employees, but to the communities, it's a great story. We've got a great story to tell. He does a wonderful job telling it. And the brand, again, identifies with our story. And we hear it all the time. Again, as I go into these offices and I talk to our folks and see what they're doing in the communities to make those communities better and build our brand equity. It's amazing to me, honestly. It's I'm taken back by how bought in they are to what we're trying to do as a company.
And I think a key part of that is, our brand is our core values. If you really look at it,
what are the core values?
Our core values are family, community, quality, and integrity.
Okay.
And they're at the core of everything that we do. Every decision that we make business-wise, the way we treat our employees, the way we treat our patients, the way we support our communities. It's all based on that, everything that we do. And that is our identity. And so when we tell our story, there's no telling our story without our core values.
Did you have the core values before the rebrand, or was
Yes,
that part
we
of
did.
it?
We did.
So you had those.
It was not a stretch. It was
Sure.
who we were from the beginning.
Sure. So what talk about everything so new logos, new fonts. What else went into the rebrand for OVP Health?
Again, it was looking at our options, and when you look at colors that you're going to choose. I told you about the Cabell and St. Mary's kind of tie, but we also looked at what do certain colors, how do they make you feel?
Okay.
Like a red color, which is what our previous color was, might make you feel tense. When you look at ERs, you use red a lot in promoting an ER, and though we're in the ER business, we didn't necessarily want to, evoke that tense sort of emergency type feeling. we wanted it to be confident, but we also wanted it to project a more of a calming sort of influence.
Right.
And when you look at green, the kind of earthy color, it actually, in doing research, you look at what are the favorite colors of men and women.
Okay.
And the research that I found proved that it was green and blue.
Okay.
Maybe one, different for men and women,
Right.
but those two were the top two for both. And so, that was an issue.
Sure.
And then you want to maintain the current brand equity that you have, but you want to build upon it as well, so that it's not outdated, and it kind of projects that forward-thinking, growth sort of oriented company that we were becoming.
Sure.
At that time. And I think it really gave us kind of a little kickstart in terms of our growth, in terms of now when we put an outpatient facility in a community, we have we're on automatic. That we know exactly what we need to do in terms of signage and colors and what color we're going to paint the outside. What we put blue metal roofs on all of our facilities now.
Right, a lot easier.
So,
yes.
Yeah, we're consistent in how we present our brand.
You mentioned Cabell Huntington Hospital. Talk about your involvement in the rebrand of that, and talk about how those lessons helped you with this rebrand.
I think it was key. And before that, actually, I rebranded King's Daughters Medical Center. I was the director of marketing and PR there. And I was there for their 100th anniversary. And so they're a lot older than Cabell or
Sure,
St. Mary's.
Yeah.
But they were a 100-year-old hospital, and their brand looked 100 years old.
Got it.
And their color was green, but they were not really associated with Marshall. They were associated with UK.
That's right. Yeah.
Or they, most people around there, they root for UK.
Yes.
But so we decided to do a change and change the color to blue. So they adopted the blue color. We also did some research and focus groups and came up with, and I worked with an agency that we came up with the Taking Medicine Further tagline. So that was the first one I did. I learned a lot about that. I didn't know a lot about that at the time, but we had a really capable agency that really educated me on that. So I took that into Cabell Huntington. Actually, I went to Genesis Hospital System first, and we did a rebrand on Genesis, but we didn't really get an opportunity to launch that before it broke apart into the two separate hospitals again. But at Cabell Huntington, our brand was old. It was, it was outdated. The tagline, "Your Partners for Life," was very well known and very well liked, and so we kept it. But then there was this, we call it the snowflake. I don't know if you're the Cabell Huntington snowflake.
Right.
And it had great retention in the minds of folks, so we kept that. But we did change the color to green because at that time, Cabell Huntington had hitched its wagon to Marshall Health.
That's right.
They had moved actually onto their campus. And I think that move was probably the single biggest move in the history of Cabell Huntington Hospitals when they associated with Marshall. So we wanted that to be green as well. So I did learn a lot of lessons from that I took into this process. And I think it's fun, but it's not something that you want to do frequently.
Of course.
Yes.
But, do you when you had that conversation with Stacey of, hey, we need to do this, do you have that conversation of this will last us 5 years, 10 years, or do you think that far ahead on that?
Yeah, I think if it's 5 years, you don't want to do it.
Okay.
If it's 10 years, that's probably the earliest you want to But that all changes if you're having problems with your current brand.
That's right.
If you have a bad reputation with that brand, you can do a partial rebrand. You don't have to do a full rebrand. You can still keep the same name and maybe stylize the logo a little bit differently.
Right.
Add that sort of thing. Not throw out the baby with the bathwater.
That's right.
So those are you might be able to do a little more frequently, but a total rebrand, I mean, you're dumping all the brand equity that you had in the old one out the window.
Sure.
And it takes a while again to build up that level of brand equity. It takes time and it takes a lot of money.
on the money, and I don't want specific dollars and cents, but if you were, a business owner, a small business owner, and you need to do a rebrand, I mean, what advice would you give them in terms of budgeting something like this?
That's a good question.
And it's a tough one.
Yeah.
Well, for us, we had, again, 6 or 7 different offices. So you're talking about signs at each of those offices, business cards, all of your paper products, our corporate office at the time. So it was a significant cost to us. I mean, and it would be 3 or 4 times that cost today. So,
okay. That's right.
if I were looking at trying to do this, and I have rebranded for the last time in my career, but if I were to do that today, it'd be more expensive. And so you go through that process. And for us, I think we try to roll out over a 4-month process, changing signs at different offices, and rolling into that new brand that we had created. And so it's not an easy process. The bigger you are, of course, certainly it's going to be the more expensive and more difficult to make that move. But I think for us, terrifically successful. And again, for us, we've been pleased with how that has been rolled out. And again, Doug's done a terrific job in managing that for us.
So 4 months it took, you think, from when you first rolled out your first sign to your last one?
It would seem to me like it was roughly 4 months. We started in January of 2020, and then I think that we was hoping to have everything done in April or so, that each of those offices will get their signage done. And because we had an office at that time in 4 states. I didn't have office in Virginia yet.
Okay.
And so it's just a lot to coordinate. And so it takes a while. And again, you kind of, because again, even answering the phone, it's a change of how the phone's being answered with a new name.
Sure.
and coordinating all that just takes a while.
And it required new websites.
That's right.
And we've got we have 5 websites now, different websites, and but yeah, I mean that took a lot of work,
right,
and time, and
and that's what I was kind of asking. I mean, could you could fill up a spreadsheet of everything that has to be done, from business cards to websites to vehicle wraps. I don't know. I mean, there's just a lot of stuff that goes into this.
Yeah, and it was really exciting, as Stacey said, to see our employees really embrace it.
Right.
And the pride that they had in getting a new shirt with the OVP logo on it. I mean, I think there are a lot of employees that's really all they wear to work now is OVP branded gear, and they wear it with pride. Today there was a breast cancer luncheon at Guyane, and we had 8 women attend that, and they all wore pink sweaters with the OVP brand on it. I mean, they just they want to show that with pride everywhere they go.
So, how much outside help did you have in this? Like you said, you had an outside graphic designer, do your logo and so forth. What other outside sources did you use for all this?
We did this very inexpensively from the design standpoint is concerned. I used my graphic designer that I used at the time was my niece.
Okay.
Who was doing some graphic design work for Air Methods helicopter service in Colorado. But she's very, very talented, and she knew exactly what we wanted.
Okay.
She gave us about 25 different options to choose from, or gave me. I didn't let Stacey see all 25.
No. Nope. No, you're smart.
He asked several times to see those, and I said, no, I'll show you 5.
Yeah.
You can see 5.
Absolutely.
You can't see 25.
Yeah.
I think he's still mad at me.
And it's not, and the low, whose idea was it to the O with the V built into the O?
That was one of the options that Sarah, my niece, came up with, and I showed the top 5 that I wanted the top 5 to be all 5 of them I could live with,
of course,
from my perspective.
Yep.
And they really kind of gravitated toward that, the O and the V that looks like the V above the V is air, and then kind of, well, let me see, it's water, and then to the side of the V it's like the banks of a river. It's the grounds. Yeah.
What challenges did you all experience during this time? I mean, a lot of this took place, I guess, during COVID, right? When you first were launching everything?
Well, that was 2019 is when we COVID didn't take place till later in 2020.
Sorry, okay.
But
yeah. So what kind of challenges were you dealing with over this time?
In 2019, I mean, there's, I always want to do things as cost effectively as possible, and I hope Stacey will agree. I try to do that. So doing it without, causing a lot of financial heartache and difficulty. So that's always something you want to do. We were doing marketing anyway. We're doing a lot of content marketing, which is getting our story out there, not necessarily with paid media, but through social media, and I produce a lot of videos, and so we were getting that out there. But any of the paid media, I mean, you're going to have to put a logo on it one way or the other. So it didn't really cost any more to put our new logo on than it would put our old logo on.
Right.
It. So that didn't change much.
Right. Again, if you were talking to another business owner, what advice would you offer them during this rebrand? One, you mentioned one. If you're going to do it, plan for the long road, do it for the long haul, not just for
Yes.
Don't plan to do this every couple of years. What else would you recommend to them?
Just be very, very serious about it, and don't make the decision quickly. Think about it a lot. Get a lot of options. Get a lot of feedback. You want to get feedback kind of before you even show it to your leadership group.
Yeah, sure.
From it can be a focus group of your friends or whatever. What you don't want is when you present something to your leadership group that you haven't really fully thought of, or
Sure.
you haven't run by other people, and get feedback on your ideas, and but what I think is the most important thing is that your company's story.
Sure.
You really have to get deep into what your company does for the community, who you are, what your values are, and your story. And we have a fantastic story to tell, and so that makes my job so much easier. Not only because of our values, but what we do for our community and the way we treat our patients and how we help our patients. So know your company that you're working for inside and out.
Sure.
Know everything you can about them, and the good and the bad. And but also, I say the brand is more than a logo. It's more than the colors. The brand is who you are,
right?
And our values is who we are. If we don't live those core values that we, brag about, then we're damaging our brand. We're not damaging our business, but we're damaging our brand. A brand is a promise. We promise we're going to treat you like family. We promise that we're going to we're going to support our communities. We promise that we're going to provide quality care, and we're going to do it in the right way, for the right reasons. We're going to, with honesty and integrity and that sort of thing. If we don't do that, then we're shooting ourselves in the foot. Our brand is not worth much.
Sure.
I couldn't agree more with it's who you are. So you got to be able to find who you are before you start the process of rebranding. Because that brand is going to represent, to Doug's point, who you are and how you're going to sell that to your community and into your clientele.
Same question though for someone in your shoes. What advice would you offer to another business wanting to rebrand? You're the CEO. You're not picking out the colors and fonts and all that stuff. And again, it's more. I like that. I love that. It's more than a brand. Is more than it's a promise, more than a logo. Mm-hmm. But what advice would you have to work with your team on doing this?
I go back to it's a great opportunity to tell your story to people who haven't been introduced to you initially, or maybe may know who you are but not your entire story. And so it's just a great opportunity to tell your story, what you do and what you're about and who you are. To Doug's point, we have a great story, and we were excited and we're still excited about telling our story to folks. And so, if you've got a business and that you're excited about and that you want to tell people about who you are and what you're doing, a rebrand is a great opportunity to do that.
Sure.
And you really need to get your employees on board.
Yeah. Can we talk about that?
Yeah. Well, I mean, our policies, everything is built around those core values. If you've got employees that aren't living up to the core values, then they need to go work someplace else.
Right.
Because that's who we are and that's who we're going to be. And we can't let those people who aren't going to work with our core values, we can't let them represent our company.
What were those conversations like with your employees about, hey, this is what we're going to do, this is our new name, and so forth? How did all those conversations go?
I think people were excited about the change. Again, it gave them an opportunity to tell people who they work for.
Yeah.
And when people say, well, who's OVP Health? Well, yeah, was Ohio Physicians. We rebranding. And again, opportunity for them to tell their people who they work for and what we do. And so I think it's been, again, from an employee standpoint, it's been extremely exciting to see them buy into, our company as a whole,
right,
our brand, and then live it every day. I mean, you go to these offices, you go to one of our food drives, and our people out donating their time and resources because they want to represent the brand.
Sure.
And they understand how important that is to us.
And that makes my job so much easier when we can post on our Facebook page pictures of our employees helping, provide, tons of food to people in need. That's telling our story, and that's telling who we are and who our employees are. But I think when you do the rebrand, you need to let your employees know about your change. You need to expose them to the rebrand before you expose that to the full community.
That's right.
Because people are going to ask, well, why did you change your name? Why are you and they need to be prepared with the answers.
Sure.
And to be able to to tell our story.
Talk about too, how has the rebrand affected like hiring and seeking employees?
Well, I think it's, again, for us, going back to brand equity.
Yeah.
And what you see us do in these communities, not only are you selling your brand to what you hope to be future patients, but really future employees.
Of course.
You're selling a culture and an environment that people want to be a part of.
Right.
That you hope they want to be a part of. And so it's absolutely crucial as it relates to people knowing who you are and what you do and wanting to be a part of that.
Yeah.
To acquire the best talent you have locally, especially in an area like ours that isn't a huge area and a ton of population, that you want to be able to make sure you try and get the best and brightest.
Sure.
In your community, and branding is part of that. Is they want to know who they're going to go work for and what they're about, and we hope that we've been able to do that.
Sure. Yeah. Is the timing of this? Did the timing of this rebrand, this decision to do this, have anything to do with, the state of the medical world in our Huntington area right now, with hospitals merging again and so forth? If it wasn't the time, it was a perfect time for all that.
Yeah, that did really play a factor into our decision as it relates to rebranding. Again, ours was, to Doug's point, we had all these little different companies out there. We weren't getting any equity out of the brand. And for us, it was just about retelling our story and bringing it under one umbrella. And it was terrifically successful.
And I think it made people more aware of, and you talked about when you're hiring, people, if you don't have to split it into 7 different companies.
That's right.
And you were one different company, then you can share that story with more people, and they'll understand that you're this one company.
Sure.
And so you'll get a better response.
And I always talk about too, like it's my job is marketing and advertising. It is really, really hard for a single restaurant to advertise. They have one location. Sure. And it's so much easier for McDonald's and Wendy's to advertise because they can just say Wendy's, and that applies to 50 restaurants within 20 miles of here. And you all can do the same thing now with all your locations. Say that OVP Health, and you might be talking about a specific office or service. It can still apply to everything else that you're doing, though.
Yeah, and it's interesting you bring up like McDonald's and Wendy's and that sort of thing, and they are iconic brands.
Right.
And one of the important things that they do is consistency. Everything is. You go to a McDonald's in Huntington, West Virginia. It's the same if you go to a McDonald's in California.
That's right.
And because they understand the importance of maintaining a consistent brand presence.
Right.
And that's equally as important in Huntington, West Virginia, as it is anywhere else. You really need to be consistent on how you present your brand. And we have a brand guide here. It's like a 10-page brand guide.
Sure. What's in? Let me talk about that. What's in it? What?
Let me get mine out here
right?
in front of here.
How often do you pull this thing out and go over it?
We pull it out quite a bit.
Sure.
We had a logo go up recently in our community, and I was concerned maybe the color of our green was a little too yellow.
Okay.
And so I got out we call it the brand Bible.
Yeah.
Because it shows every variation of the logo you can use, all the colors, all the fonts, how it's not to be used, how it is to be used, all the PMS colors and the CMYK and RGB, so that you can match the exact color. Our logo is green and blue. It's difficult to put a green and blue logo on a blue shirt because the blue will.
That's
so
right.
There's ways that you can
outline
present
it in white?
Exactly,
right? Yeah,
exactly.
Yeah.
There are ways that you can do that, it's a lot.
No,
and so you really need to make sure that your logo is used consistently.
Sure.
Across the board. Otherwise, you just chip away at that value.
Stacey, what have you been most excited to see? What do you get excited to see your logo on?
Everything.
Right?
Yes.
Yeah. No, okay.
I mean, and honestly, it's nice to people know who you are and what you do.
Yeah.
And I continue to see more of that. Well, I was literally in Raleigh for the Marshall game, and a guy walked up and said, do you work with OVP Health? I said, well, yes. And so it's just neat that, to Doug's point, in 2017, that we're finally getting recognition for the brand and the equity that we've created in that brand. And so that, you got to take some pride in that.
Yeah. And we just recently saw our logo go up on the back of the scoreboard
right.
for the football stadium, and it's pretty big.
Yeah. Yeah. And it looks great inside this. I've seen it going up on the backside. I've not seen it completed yet. And and on the inside it looks great. I mean, it really does. So.
Yeah. Yeah.
What are there any other future strategies coming up, with the rebrand that you can share, discuss? Hey, we're going to do this. This is another step in our rebranding.
No, I think we've got that all kind of. We know the plan. We know if we're going to go into another area or whatever. We've got the plan for how to do that, and the most important thing is consistency in each time you do it.
This has been In Your Business. I'm your host, Reeves Kurtner. Thanks again to Stacey Shai and Doug Sheils from OVP Health for joining us. Thank you for listening. If you enjoyed this podcast, please like, subscribe, share, and even leave us a review. Season 1 of In Your Business is presented by Moses Auto Mall of Huntington, MosesMeansMore.com, and powered by the Huntington Regional Chamber of Commerce and Kindred Communications.